I was working a night shift just the other night at a small hospital that doesn't have critical care services. And I had a patient that was very ill and needed critical intensive care. And I called 11 hospitals in the Birmingham and Tuscaloosa area, and nobody had a critical care bed available. So that goes to show how tenuous the system is right now and how overtaxed we are due to very sick coronavirus patients. So at DCH, I'm proud of how early we got started. When we saw how badly Italy was suffering and we knew the virus was traveling from China in our direction, we started to prepare early on. Our biggest charge when we saw this thing coming was, how do we keep our nurses safe? How do we keep our doctors safe? How do we keep our patients safe? We don't want to be a hub that infects the whole community, because everybody with coronavirus will be coming to the hospital. It was wear masks, do good hand washing, and what we call it in the medical field is droplet precautions. So keep a good distance, a social distance of 6 feet, wear a mask, and wash your hands consistently. We've tried to use telemedicine services where you can call and visit your family member at least over a FaceTime or a Facebook call. And the same thing with some of the physicians' offices, to be able to call your doctor and get treated remotely. And we've had very, very low infection rates among doctors, nurses, and patients, a population that really should have the highest level of infection because you're exposed to it so frequently. To get the kids back in school and to get our economy running the way we want it to, we have to do some basic things to fight this virus, and wearing a mask is very, very minimal to ask out of the things we could be asked to do. It wakes you up a little bit to understand that you could be a victim and that not wearing a mask could make your family a victim, and it really changes your perspective on how to approach it. So the sooner we can get the entire community and the entire country on board with wearing masks, the sooner we can reopen and get back to a normal life where we all want to be.